These are my top 3 reasons why contrast-enhanced mammography will become the go-to for average to intermediate risk women with dense breast tissue. I'm Dr. Zach, a fellowship-trained, board-certified radiologist. So on the left of your screen here, this is a left envelope projection digital mammography picture. As you can see, this woman has dense breast tissue, and we know she has dense breast tissue because she has more white than the black around black on that image. To the right on your screen is a contrast-enhanced mammogram recombined image, or also known as the contrast picture. And this is a negative left envelope projection of a contrast-enhanced mammogram picture. If it were positive, there would be a white blotch on it. Same thing goes for when we're looking for a cancer on these digital mammograms. To the left of your screen, we're looking for white. The problem is when we look for white on white, we can miss it, especially when it's small. This is why supplemental imaging should be considered in all women with dense breast tissue. So my top 3 reasons why contrast-enhanced mammography will become the go-to is, 1, it has a similar cancer detection rate to MRI. And contrast exams, if you've watched any other of my videos, contrast exams catch way more cancers than digital mammography, including with digital breast tomosynthesis or 3D mammography, and ultrasound, including handheld and ABUS, which is the automated breast ultrasound, which is pretty much a machine arm that does what the tech would normally do or the radiologist would do in doing a whole screening breast ultrasound. Number 2, the cost. Cost of a contrast-enhanced mammogram is anywhere from 1/4 to 1/10 the cost of a breast MRI. Now, unfortunately, money shouldn't have to plumb into medicine, but it does, and it's becoming the biggest factor of what decides what care you get. Logistics is number 3. Contrast-enhanced mammograms are done in the breast imaging department. There's no reason that we have to fight for table time with other specialties. And when I talk about table time, I mean we're fighting with the orthopedics for MRIs of knees and shoulders and ankles and elbows. And we're fighting for all the neurologists and all your neurosurgeons for table time with the breast MRI so that they can get their brain scans, their spine scans, and pretty much any other imaging. That MRI machine is constantly running. If it's not running, they're losing money, is what we say in the business. And breast MRIs, they do not get paid as well as other exams. So breast MRIs get less preference if there is an opening in the schedule. Even with patients with breast cancer, try to get an MRI at your hospital. Almost impossible to get in soon because they're giving preference to the higher cost machines. And lastly, with a contrast-enhanced mammogram, you get same-day results. You get an instantaneous read. You will have your read that day. Now, I'm actually in the room when we do these contrast-enhanced mammograms, and I tell you when it's done, whether it's positive or negative. And if we need to do another testing, we do it that day. So MRIs, if anyone has gotten an MRI before, you're not going to get your results. You're lucky if you get them within 24 hours now with the shortage of radiologists. Sometimes it can take days to weeks. So these are just some reasons why contrast-enhanced mammograms are going to become the go-to, in my opinion. Once we get more information, like I said before, similar cancer detection rates and similar false positive rates. So whether we're recommending a biopsy that doesn't yield cancer or we recommend follow-ups, these false positives are the same as what we get on digital mammograms without contrast and MRIs. So lastly, I'll end with this. Women who have had both breast MRI and contrast-enhanced mammogram, 4 out of 5 of them said they'd rather have the contrast-enhanced mammogram. So look around your area, see if anyone's offering contrast-enhanced mammography. They estimate that up to 50% of breast imaging centers are going to have this in the next 3 to 5 years. So know about it, request it, be your own advocate. Don't... I constantly hear the screening ultrasounds. Look into the statistics. Densebreastinfo.org is a great website. Don't take my word for it. Go check out the non-for-profits. They're putting out the literature more so than these big academic centers. The big academic centers, they're kind of shying away from giving what they think we should do. And that's because some of the big academic centers are actually owned by insurance companies.